Good afternoon and welcome to the March 23rd Buncombe County COVID-19 Community Update. My name is Stacy Wood and I'm a Public Information Officer here with Buncombe County Health and Human Services. Today we have Stacy Saunders, the Buncombe County Public Health Director, here with us to provide an update on the COVID-19 response in Buncombe County. As a reminder, you can find this community update in Spanish in real time on the Buncombe County Facebook page, Buncombe County Health and Human Services Facebook page on Facebook at BCHHS. And so let's go ahead and get started with an update from Stacy Saunders.
Good afternoon, friends and neighbors. Thank you all for joining us today for an update on our current COVID-19 trends and vaccine rollout. Let's start with our latest indicators. Over the last year, we have identified 16,194 confirmed COVID-19 cases in Buncombe County. 294 COVID-related deaths have occurred in our community. While we have not experienced a new COVID-19 related death in about a week, it saddens me greatly that we've experienced almost 300 deaths in the last year due to the pandemic. We are seeing about 30 new cases per day enter our public health workflow. This is a decline from 4 weeks ago of about 54%. Our new cases per 100,000 per week today is 86. After over a week of stability and what appears to be a plateau we have experienced in the last couple of days, our new cases per 100,000 rate being in the 80s. Additionally, our percent positivity has plateaued. For 3 weeks now, our percent positivity has been between 2.8 and 3.4%, with it averaging around 3.0% with slight fluctuations plus or minus daily. Today, the percent positivity is 3.4%. It is welcome news that we have not experienced a COVID-19 related death in about a week, and our hospital indicators remain stable and favorable. But the uptick in new cases and the percent positivity, while well below 5%, is not decreasing any further, concerns me. I want to see us continue to reduce our new cases rate and our percent positivity. COVID-19 testing numbers continue to fall from winter surge levels and are approaching levels that we saw in the summer bump. While we expected testing to decline after exponential increases during the winter surge, it is still important to get tested if you have been exposed or have symptoms. And right now, testing continues to be very important. The virus continues to spread, and with its variants circulating, we are not at the finish line yet. Until more of the population is vaccinated, testing remains a vital tool to help identify new cases quickly and reduce transmission through isolation and contact tracing. So much progress has been made with decreasing cases and getting more and more vaccine into arms, but we still do not have enough of the population vaccinated to stop doing the things that matter, like wearing your mask, especially in public places and with people outside your household, and keeping your distance and washing your hands. I am urging you not to let your guard down now. We are most effective in reducing the spread of disease when we layer our approaches versus just relying on one intervention. Utilizing community testing and continuing tracing efforts, plus mask wearing and other precautions on top of our continued vaccine distribution will prove to be effective force multipliers. If you are experiencing symptoms of COVID-19 or think you may have been exposed to COVID-19, please seek out testing so not to potentially infect those you love and care about. You can check out the Find My Testing Place website to find a testing location or event near you. Please remember that a new testing provider is available in our community through a partnership of Buncombe County HHS and North Carolina DHHS. This is free and is located at AB Tech on Sundays. Please visit starmed.care for more information and to register for a testing appointment. Please help us reduce the spread by getting tested if you are having symptoms or have been exposed. As mentioned, vaccination, along with testing, tracing, and precautions, is a vital component of our fight against COVID-19 and getting back to a more normal time. Buncombe County HHS is currently vaccinating individuals eligible in groups 1, 2, 3, and 4A. These include healthcare workers, individuals 65 years and older, frontline essential workers, adults 18 to 64 with high-risk medical conditions, incarcerated individuals, and those experiencing homelessness. Our current weekly baseline allocation is 3,510. This is an increase from the last several weeks. In addition, Buncombe County HHS is receiving 300 doses for equity purposes. Our baseline doses are being used to continue to work down our wait list, which now has roughly 15,000 active individuals. We are currently scheduling individuals with confirmation numbers in the 62,000 to 65,000 range. We are excited to be working with our partners at Western North Carolina Community Health Center this coming week to vaccinate historically marginalized populations in the frontline essential worker group with our equity allocation. Additionally, Buncombe County HHS accepted a transfer of 400 doses from our hospital partner for outreach and vaccination of individuals at our local detention center and individuals experiencing homelessness. As of yesterday, 3.6 million total doses of vaccine have been administered in North Carolina. In Buncombe County, 94,345 total doses of vaccine have been administered. About 23% of the total Buncombe County population has been at least partially vaccinated, and 13.5% of the county population has been fully vaccinated. Buncombe County HHS and our partners in emergency services have administered over 49,830 total vaccine doses since beginning on December 22nd. Almost 30,000 of these have been first doses, and just over 20,000 have been second or single doses. I am so thankful for our team and the teams of every vaccine provider in our community for your dedication and hard work in getting shots in arms. More vaccine providers receiving federal or state or local transfers of vaccine means more access and more opportunity for our friends and neighbors to get their shot when they are eligible. If you are in one of the current eligible groups, 1 through 4A, and are interested in receiving vaccine, please check out myspot.nc.gov to find a vaccine provider in your area. If you are not sure what vaccine group you are in, please visit findmygroup.nc.gov to learn more. And just a reminder, you may receive your first dose at any location, and it is important for you to return to that provider for your second dose. All second doses are sent based on your first dose allocation administration. Your first dose provider will have your second dose. In closing, please remember, the fight is not over. We are certainly not seeing case levels as we did during the winter, but I remain concerned about the plateauing that is occurring in many of our indicators. Please be diligent and committed to all precautions. It is still incredibly important to wear your mask, keep your distance, and wash your hands when with folks outside your household or in public places. Remember to get tested if you are having symptoms or you think you may have been exposed to the virus. This is also incredibly important. Finding new cases quickly is the key to reducing the spread of COVID-19 as we continue to roll out vaccine throughout our county, state, and our country. And lastly, get your vaccine when available to you. We have 3 safe and effective vaccines available in our state. If you are wondering which is the best for you, remember they are all safe and effective at reducing deaths, hospitalizations, and severe illness. The best shot for you is the one available to you at your appointment. This trifecta of using precautions, testing and tracing, and vaccine distribution is the winning combination in the fight against COVID-19, and it requires your participation at every step. Please do your part to stop the spread of COVID-19. Thank you for your time and attention today. Take care and be safe.
In closing, thank you for tuning in today. And as Stacey Saunders said, now is not the time to be complacent. We should all continue to take COVID-19 seriously. Let's continue to stand shoulder to shoulder to slow COVID in Buncombe County. For more information on COVID-19, testing, vaccinations, please visit buncombeready.org. Thank you.